summarize what has been achieved and what still remains to be achieved. Before we start, I would like to thank everyone who registered. More than 350 registrations for this webinar. As we are starting, we can see the numbers of people joining increasing. Thank you for everyone expressing this interest. We have had quite a number of exchanges in social media as well, which says that actually the patient community is being more and more engaged in the concept, but also in the implementation. We believe that these kind of webinars would really help us understanding what is happening at the global health agenda, regional and national policy priorities, but also how can patients engage? And this is the title of our webinar today, Universal Health Coverage, How Can Patients Engage? Before starting formally into the program, I would like to remind everyone of the rules. You're all familiar with webinars, but the culture of the webinar says that please keep yourself muted while you're on the webinar. We are providing simultaneous translation to Spanish, so you can please check the translation icon and switch to the language of your preference. If you have any questions or comments, please use the Q&A tab. The chat is, of course, always open, but we prefer to keep the questions in the Q&A so that we can easily grasp them and address them at the end of the webinar. With this being said, I would really like to once again welcome you, everyone who joined us, but more so to welcome our distinguished speakers at today's webinars. We are very grateful for you being with us today. Briefly going through the program. So I never introduced myself, so let me introduce myself first. My name is Neda Mirovska-Kostova. I was serving as a board member and a chair of IAPO. I'm very proud of that position and of the achievements that IAPO has today has achieved until today, and I hope that we will continue in the same path and even elevating IAPO to higher heights. The topic of this webinar, as I mentioned, is the universal health coverage, not only to mark the day, but to see what is the progress achieved and what still remains to be done. Among the distinguished panelists of today, we have Justin Kunin, who is the current co-chair of the UHC 2030. He's also president of ACON Australia, adjunct associate professor at the Kirby Institute at the University of New South Wales, Australia. And he's distinguished fellow and honorary professorial fellow at the George Institute for Global Health. We have Elos Lodzeni today with us. He is the new chair of the International Alliance of Patient Organizations. Welcome, Elos. And I really would like to congratulate you on taking this new role. Elos is a long-term patient for patient safety champion. He is the real patient advocate, advocating for the patient rights and for the universal health coverage and patient safety in Africa. Next, we have Nicola Bedlington. Our dear Nicola, welcome and thank you for joining us. Founding partner of Millwater Partners and former Secretary General of the European Patient Forum, but also involved in many patient-led initiatives. Thank you for being with us today. And last but not least, we have Marjolaine Nicola, who is a coordinator, actually I would say quite the most important person in the International Health Partnership for UHC 2030 that is hosted by the WHO. And thank you, Marjolaine, also for being with us today. In the light of the presenters and in the light of the speakers' expertise and experience that they bring, I would like to briefly give a very short introduction of what this webinar really is about. This is about understanding what are the pathways that each patient organization, patient advocate, or the patients themselves can take in order to improve the universal health coverage achievement of the goals. We all too well know that universal health coverage is far from achieved, that it is still a distant future, and the commitment of setting up a decade until 2030 speaks that there is a great need for many, many actions to be taken. But we sincerely hope that in 2030, we are not going to be faced with the need for having another decade, and therefore organizing these kind of webinars and events are important for exchanging what is committed by the governments at global, regional, and national level, and how we as patient community can engage so to speed up the process of achieving the universal health coverage. With this being said, I'm going to invite us to watch a video from Justin Kunin, who unfortunately, because of the time zones, could not join us in person, but he has kindly offered to share his message as a co-chair of the UHC 2030 of what UHC 2030 has done, what the political declaration on UHC meant, and what are some of the steps we need to take. Let's have a look at the video.
I'm going to talk about the recent high-level meeting and political declaration on UHC. But before that, let's go back to basics. UHC means that all people have access to the full range of quality health services they need when and where they need them without financial hardship. If countries can achieve UHC, they can greatly enhance the health and well-being of their people, in particular that of children, girls, and other vulnerable populations. UHC includes two important components: service coverage, in other words, who and what gets covered, and financial protection, that is, ensuring that people are not pushed into poverty in accessing health services. With UHC based on a people-centered approach such as primary health care, countries can not only deliver the right to health, but also strengthen their people's resilience against health threats from pandemics, climate change, and humanitarian crisis. I don't have to tell you how important each of those are at the moment. Moreover, UHC and health in general are preconditions for sustainable development in general. By making progress towards UHC, countries make progress towards other SDGs, towards social justice, and towards an equitable future for all. But the current situation in countries is dire. Progress on UHC is far off track. 4.5 billion people, about half the world's population, lack access to essential health services. Nearly 2 billion people experience financial hardship due to out-of-pocket healthcare spending, including 344 million people living in extreme poverty, most of them in the global south. As Dr. Tedros mentioned, we need political will to realize the right to health. This year, at the UN high-level meeting on universal health coverage, the world took stock of progress towards UHC. It was the second high-level meeting on UHC following the first in 2019. The political declaration adopted at the high-level meeting is a sign that countries remain committed to achieving UHC by 2030. Member states reaffirmed the importance of prioritizing investment in primary health care as the most effective, inclusive, and equitable way to make progress towards UHC, as well as the overwhelming evidence that public finance is critical. We had aspirations for the political declaration to be a concise, action-oriented document with clear accountability for progress. But if we're honest, we did not get that. Moreover, the high-level meeting arguably did not gain the political traction we'd hoped for. We would have hoped to have had more heads of state and government in attendance and clearer action-oriented commitments in the political declaration. So where do we go from here? Ultimately, universal health coverage is not achieved at high-level meetings in New York or Geneva, but on the ground in countries. If the discussion taking place in those cities doesn't also translate into meaningful action in Soweto, Sao Paulo, and Lahore, then what's the point? It's now up to governments to implement concrete steps to achieve UHC. And the roadmap to do so is clear. What is needed now is political will and investment. To make sure that political commitments translate into action, we need to work more closely with parliamentarians. Someone wise once said that true love is shown in the budget. If commitments and policies are not translated into laws and budgets, they will remain empty promises. So on this UHC Day, let's all call on all of our members of parliament to ensure that national legislation prioritizes UHC, focusing on the needs of vulnerable and marginalized population with a special focus on gender equality, to hold governments accountable for making actual progress on UHC, not just promises, and to ensure that public financing and public funding prioritizes investments in primary health care. At UHC 2030, we also believe that you can't achieve UHC without a whole of society approach. Governments alone cannot deliver health and well-being. People should have a say about their health. We need everyone. We need to involve everyone to ensure policies reflect people's needs and create the necessary trust in public action. As patient advocates, you know this, and that's why the role that you play is so important. In the lead up to the high-level meeting on UHC, we co-developed a so-called action agenda from the UHC movement in consultation with a broad range of stakeholders, which you can think of as a set of consolidated asks from the UHC movement to world leaders. One of the specific asks contained in the action agenda is for the institutionalization of mechanisms for social participation. And by that, I mean the active engagement of civil society and communities in national and subnational health planning processes. Often people from government aren't used to doing things like this. They're not used to involving the population in health planning in this way, and they ask us why it's necessary. Sometimes governments don't like doing it because it's a way of holding them accountable. But when you engage with civil society and communities in a transparent manner, you build trust. And without trust, we go nowhere fast. We all saw that during COVID-19. So what's needed right now is to build capacity on both sides, both within government and within civil society, for social participation. And patient groups and patient organizations are a really important part of this picture. Your voice behind this movement is critical, and we're really grateful for what you're doing. Looking ahead, we'll make sure that we work closely with the IAPO and its membership in taking this process forward. As we all know, we have an enormous amount of work to do if we're to get anywhere near the UHC targets that we've set for ourselves for 2030. So we're very glad to have you on board. Thank you.
Thank you so much to Justin for this really powerful message. And it is really a call for action for the civil society, and especially mentioning IAPO as one of the partners of the UHC, one of the members of the UHC, which we believe as IAPO, representing nearly 300 patient organizations and alliances across 70 plus countries, representing more than 50 disease areas. They really have a lot to contribute in these processes. But as Justin mentioned, there is still a lot to be done. And of course, we need to call upon the governments to set aside budgets and have a political commitment. But at the same time, Justin reminded us that it's not only about governments doing everything on their own. It's a common effort, it's a multi-stakeholder effort. And in this sense, I would like to invite Ella Slodzeni, as I mentioned, our new chair at IAPO, to really tell us what the political declaration on UHC means for IAPO and for the patients, and really to share with us some good examples of what on the ground patients and patient advocates can do in order to promote universal health coverage and make an example for other countries. Elos, the floor is yours.
Thank you very much, Neda. Good day, everyone. Maybe for the purpose, maybe that are hearing IAPO for the first time, IAPO is a global alliance representing patients of all nations across all disease areas and promoting patient-centered healthcare across the world. We influence global healthcare policies, amplify the patient voice, participate in innovative patient-led research, develop patient organizations' capacity, as well as build cross-sector alliances. Now, why does the 2023 political declaration on UHC matter for patients? It is important to build on the momentum of the high-level meeting on UHC and the political declaration adopted at the meeting, which recognized the value of including the patient voice in universal health coverage. UHC covers the full continuum of essential health services from health promotion to prevention, treatment, rehabilitation, palliative care across the life course. It is a lot, and all these are centered at the patient. Earlier this year, the World Health Organization Executive Board shared a roadmap for reorienting health systems to primary health care as a framework to achieve UHC. PHC is the entry point to healthcare and the best platform for integrated care. It therefore paves the way for more sustainable health system, but also for enabling more accessible, safer, resilient, and high quality care for patients. These are all prerequisites for UHC. Health systems must learn from patients' experience. The WHO framework for meaningful engagement of people living with NCDs clearly includes the need for meaningful participation of individuals with lived experiences of health conditions. And this provides a powerful expertise and narrative critical to shaping inclusive, equitable health policies, programs, and services. Patients have the right to be part of the decision-making process and must be actively engaged in health planning and delivery. With this in mind, it has been continuously working to ensure that the patient's voice is meaningfully integrated. Our strategic plan in IAPO focuses on advancing patient-centered universal health coverage. We are committed to promoting patient engagement in achieving UHC at global, regional, and national level. We are therefore joining forces with different stakeholders for the operationalization of ideas and making tangible impact in advocacy for UHC. We are one of the partners of the UHC 2030 movement and will continue our collaboration towards raising awareness of the importance of holding governments accountable in investing in UHC and also discussions on the institutionalization of mechanisms for social participation. Now, how do we ensure that the UHC is patient-centered? There are a number of parameters. There are a number of things which we need to ensure and make sure that they should exist. In terms of investment in PHC, we need to ensure that there must be massive investment towards PHC, since all efforts are going towards that, it being an entry point if we have to achieve UHC. As patients, we need to be familiar with the local PHC structure in our environments. The other issue is, as patients, we need to be action-oriented, vibrant, so that we also provide a collective patient voice. And one way through this is having a strong cross-disease collaboration. Being patient organizations, we need to move away from the approach of working in silos or in fragmented manner. We need to come together as patients so that we give a one united collective voice. In unity, there is strength. In terms of empowerment, we need to ensure that There is patient and community engagement at national and local level health governance structures. If we are in those governance structures as patients, it will be a safeguard to ensure that our voice is taken. And in as far as equity is concerned, most of the services which take place in as far as health is concerned, they do take place at the grassroots. And this is where we have a lot of vulnerable patients who don't even have the monies to pay or travel for the health services. So there must be maximum grassroots access in as far as comprehensive health services is concerned. The marginalized and vulnerable patients must be able to get the services when they need them anywhere in their localities. Safety is another element which we need to ensure that it must exist. The next. Now, in as far as the road towards UHC is concerned, Malawi is a typical example of a country that is ensuring that it achieves the UHC. And Malawi worked closely with the patient community. I was one of the advocates in as far as the hepatitis program for Malawi is concerned. In 2016, the WHO adopted a resolution to eliminate hepatitis by 2030. During that time, there was total silence in Malawi in as far as providing services to hepatitis. What we did was to approach the Ministry of Health using my organization, the Patient and Community Welfare Foundation of Malawi, in order to influence the ministry to take action. We had several meetings and it was not easy to move the ministry to start working on hepatitis. But later on, the ministry acceded to our advocacy. They approached WHO country office to come and do a rapid assessment. And they also, in addition to that, elevated the status of the hepatitis, which was a unit. There was just a focal point in there. And then they integrated hepatitis into the Directorate of HIV and STIs. That made it possible for hepatitis to benefit from the resources from the Global Fund and other development partners. 7 years down the line from our advocacy, Malawi now has a fully fledged hepatitis program. What do I mean a fully fledged hepatitis program? In that, the services which are not being provided, such as screening of pregnant women, routine immunization of children, which was not very done at a high level, vaccination of high-risk groups, such as the prisoners, the healthcare workers, sex workers. All these were not done to the maximum, even to the benefit of people at the grassroots level. But now we have all these services taking place. And in terms of the resources, they are coming there from the various donor partners, as well as the government is putting resources into the hepatitis program. So this is a typical example of what patients can do. We managed to move the government. So it's important that patient organizations, patients must be part and parcel of the road which we are going towards UHC. The next. My final remarks from the presentation I've made. Patients must be placed at the center of healthcare as a co-creator, not as someone who is coming to beg for health services. There must be sustained inclusive engagement and empowerment of patients in all health and governance-related activities. As patients, we are there. In terms of the political commitment, as patients, we are saying we need high-level political commitment, which must prioritize resources. And those resources must go towards primary health care level. Once we move the resources, we call upon also the need for greater transparency and accountability, so that those resources must not develop leaks. They must be available for the vulnerable patients. Lastly, in order to ensure that the UHC takes into account the patients, we need to make sure that there is provision of comprehensive and integrated services coupled with a multi-sectoral approach with the patient as a prime partner. And the patient as a prime partner, what we are saying is, let's have us as patient organizations, we must organize ourselves so that when we are meeting these policyholders, we should meet them as a patient alliance, one united collective patient voice. Thank you very much.
Thank you. Thank you, dear Elos. I really echo what you are saying. And actually, I really like the prime partner message at the end. I must say that there are a lot of messages in the chat coming through as related to the importance of this webinar, but also on the excellence of your presentation. And thank you for really sharing a bigger overview of what it means, the political declaration for the patients and how we can engage. But I would like to further think more about the example that you shared with hepatitis program in Malawi, because that is actually what patient organizations need to do. So actioning on a specific issue or particular problem that they have, interplaying it together with the government. Here you mentioned the WHO involvement, the country office, and I think this is the right example that the other organizations can take into account and can take into their own agendas, not specifically only for hepatitis. It can be translated into any other condition or disease or any other unmet need that they have. So thank you very much for that. And this actually speaks a lot about how alliances such as IAPO or even the European Patient Forum can play a role in translating the global health agenda into the actionable examples or actionable processes for their members or for smaller organizations at the national and local level. With this being said, thank you again, everyone, for putting messages in the chat and presenting yourselves. Also take the Q&A tab for the questions. I would like to now invite Nicola, because I mentioned the European Patient Forum, and I think your role in the European Patient Forum over the years has been very much critical in putting patients into action. And with some of your recent work as well, especially in UHC, maybe it would be good if you can share your experience with us on how we can advance UHC through integration and the community voice and the partnerships. So please, the floor is yours, Nicola.
Thank you so much, Nadia, for that very kind introduction. It's a privilege to be here for this important webinar, really marking UHC Day, but also really unpacking how we can enhance the patient's voice moving forward. And this is very much the premise of the Global Patient Think Tank, which I have the honor of chairing, and I'll talk about that a little later on in my presentation. But I'd like to also explore some very tangible examples of where patient leaders are driving real progress in UHC for their communities, building on Ellis's excellent example from Malawi. So if we go to the next slide. As we heard earlier, a multi-stakeholder participatory whole of society approach is critical. And this was firmly underlined in the UNGA meetings in September, hand in hand with the recognition that UHC is central to achieving the SDGs, the Sustainable Development Goals, more broadly, not only in the context of Goal 3 on health and the targets there. Patients, through their lived experience, provide unique and vital insights, really complement the voice of stakeholders, demonstrated by CSEM, for example. And there's a welcome thrust now towards action, real implementation on the ground, understanding that UHC needs vary regionally and locally. One size doesn't fit all. But patient communities, as we heard, patient communities worldwide can make an invaluable contribution towards UHC at all levels, with a full circle, local to global, global to local approach. Next slide. Allow me to share with you then 3 really powerful and concrete examples of actions with patient communities to move forward on UHC. First, in the area of eye health, through the sterling efforts of the International Agency for the Prevention of Blindness, IAPB, eye health is now firmly on the UN agenda, and this has been translated into local level actions. So how was this achieved? First, by reframing preventable blindness from a health-only focus to a holistic, sustainable development focus, making it much more tangible and easier for policymakers to grasp, recognizing the broad scope of topics which connect to eye health, education, road safety, employment, for example, and really developing the right sort of evidence base around that for the policy asks. Creating a UN platform, the UN Friends of Vision, to really maintain the momentum and keep that candle burning. And forming impactful local alliances for implementation with all of the relevant stakeholders and building in that capacity building piece, which is really important as well. And we see similar success in the area of rare diseases through a parallel global to local approach steered by excellent patient organisations with a wide membership, such as Rare Diseases International and Eurodis. They provided really critical, unequivocal evidence on the socioeconomic burden of rare diseases, so linking it immediately to the sustainability of health systems. Also driving a UN resolution on rare diseases, again focusing on that holistic approach to the real needs of people living with rare diseases and their families. Supporting cross-border collaboration, really showcasing empowered local rare diseases champions, driving UHC progress that is really anchored in the local realities, with all of those many shared learnings pulled together and disseminated effectively by the organizations. And again, building on the example that Elos gave at national level in Malawi, a national example from Europe, from Ireland through IAPO, a patient-led platform using the backdrop of international UHC efforts to co-develop initiatives with national policymakers under the banner of patient and public partnership. So really getting the commitment and the leadership of government and people really pushing the agenda from inside governments, policymakers becoming really convinced about the importance of involving patient leaders and putting them into positions of co-chairing initiatives, co-chairing platforms, etc. So looking at them very much at eye level on equal terms as equal partners. These are excellent examples, but as Elos said, there remains much more to be achieved to really integrate the patient's voice more comprehensively, representing the entire community, the entire movement. And I think the word unity is absolutely critical here. So if we move to the next slide, please. This is essentially the rationale behind the Global Patient Think Tank, which was set up earlier this year. Convened by Roche, it brings together a diverse range of patient community leaders to really sit down, take time, think and reflect together on how to create that collective voice. And during late spring and summer, we co-created together a joint statement calling on relevant stakeholders to include patient community perspectives systematically in global UHC decision-making and national UHC design and implementation. And this joint statement was disseminated and discussed around the UNGA meetings, and of course amongst the networks of the Global Patient Think Tank members, together with a guide to be able to spread the news, spread information, relevant information about the joint statement and how this could actually be used in practice and be a helpful instrument to advance UHC locally, to really orient towards meaningful UHC advocacy that makes sense in a local context, to engage in evidence generation, patient-led evidence generation, highly compelling, discuss UHC commitments and policies, and indeed, as we've heard earlier, accountability, and co-develop initiatives involving patient communities. So the joint statement is now out there, available to use by anybody who is interested in driving it forward. It really puts to the fore the importance of involving the patient's voice, not as a nice thing to do, but as absolutely crucial to bring in that vital patient perspective to good policy making and good practice. Next slide, please. This slide shows the diversity of our global patient think tank, and it really is fantastic to have Elos and Danny from IAPO on board, really to ensure maximum synergies with IAPO's really vital work on universal health coverage, and again bringing to the fore the importance of primary care, quality of care, and indeed patient safety, those really key pillars there. Other members include Desta Lacu from AMREF Africa, Smitha Sadavsvina, who's from India, also very strong in the disability movement and linking nicely that disability human rights agenda, and indeed collaboration with CSAM, and many other really inspiring leaders that are coming from very diverse and very interesting communities from across the globe. Next slide, please. So building on the joint statement, in 2024, next year, we'd really like to focus on how we could best support local patient leaders on the ground, helping those who are really embarking on the UHC agenda and policy making to really understand the local environment, what the opportunities are to engage, and to provide guidance and support on how to advance their efforts based on good practice and learnings from peers, and based on how to network, how to collaborate with kindred spirits, with other stakeholders that are really helping to drive the agenda. And again, this is hugely complementary to the efforts of IAPO and all of your members. And so it's especially pleasing to be here today and to be able to get involved in the discussion a little later on in the webinar. Thank you very much for having me.
Thank you, Nicola. Thank you. I cannot express my gratitude and on behalf of IAPO, I cannot express my gratitude enough for really having put forward in front of us the nice examples, the great examples from the for the eye health, the rare disease, which is just in one word, 5,000 to 6,000 diseases embedded. And all the other great initiatives that our patient organizations, the members and the wider patient community can use as sort of templates on how they can deconstruct the universal health coverage at the local level and try to pinpoint on specific needs of patients, such as the example also shared by Elos on the hepatitis program in Malawi. But furthermore, I really would like to thank once again and invite the participants to go and look for the GPTT, the Global Patient Think Tank statement, because we as patients or patient advocates, we would know sometimes intuitively, sometimes from experience or from practice, from everyday lived experience, we would know what is needed, but it is often difficult to put it in the right words for the policymakers. So statements like the GPTT one can make a difference in how we advocate in front of our local and national governments. And in this sense, we are also very grateful for you sharing the plans for the 2024. And I think there will be possibilities for patient organizations to also contribute to mapping what is that the patients can actually do to feed this process, and vice versa, how they can use the statement and the other activities being taken forward by the think tank, but also European Patient Forum and all the other patient-led initiatives that you're involved in. So thank you so much. We have some questions later on for you, Forelos. And before that, I would like to invite Marjolein Nicot to speak a little bit more. Actually, fits quite nicely with what you said, Nicola, that there will be possibilities in the 2024 on how the patients can express their needs or how they can engage more specifically in the UHC. And I think we as patient organizations or alliances also are not expected to do things only on our own or only to fight in a sense of advocating, but to collaborate and pursue universal health coverage in partnership. And I think the Universal Health Coverage 2030 International Partnership hosted by WHO is one great example of how civil society is given the floor and the platform to also participate as much as possible in the processes. And as you mentioned, both prime partner and being at the eye level to create this unity towards universal health coverage. So dear Marjolein, thank you once again for accepting to be part of this distinguished panel, I would say. So we would like to hear from you a little bit or more on what are some of the current developments at the UHC Day 2023, also some concrete activities and opportunities, so how we can engage as patients and patient advocates. Thank you very much. The floor is yours.
Thank you, Neda, and hello, everyone. So before I respond to the specific question, I'd like to say a few words about UHC 2030, since many of you on the call may not be familiar with UHC 2030. And actually, I like the remarks that you made, Neda, because UHC 2030 with an organization like IAPO and its member partners, we don't exist. There is not a single civil society organization around the world working on universal health coverage as such, but we convene probably more than 1,000 organizations working on different aspects of health and population issues, and without all of you, we can't exist, and we are here to exactly help you not feel lonely and make sure that your voice can be heard. So UHC 2030 is a multi-stakeholder platform which brings together diverse voices and perspectives for the common goal of achieving universal health coverage. And we focus on promoting political commitment and collective action. We convened and build connections through joint high-level events or gathering of experts. We focus on change in countries, but we do not work in countries directly. We can only do it through our partners. And for this, we provide some advocacy tools, guidance, knowledge, and learning. So our role is really to help different stakeholders to take more effective and coherent action, to support efforts at the country level to make progress towards universal health coverage based on a shared vision for equitable and resilient health systems based on primary health care, so that everyone can be protected and not left behind. So as mentioned, we bring diverse constituencies, including government, international organization, global health initiatives, foundation, civil society, and the private sector. The civil society engagement mechanism is our civil society constituency. Nicola has referred to it in her presentation. It currently brings more than 1,000 organizations worldwide in more than 100 countries, and it's very diverse. I mean, from international NGOs to very grassroots community groups. And I don't have the full picture numbers, but I'm sure that there are many patient organizations. And I can at least mention Smita Sardasan, who is, understand, involved in the patient organization or patient think tank, patient voice think tank. She sits on our steering committee, and she's very vocal and makes a good job at elevating the voice of patients. As mentioned by Justin in his presentation, we believe in a whole of society approach, and we need to make sure that we elevate the voices to make participatory governance in health becoming a reality. It's not something nice to have, as already mentioned, it's a must. And we are promoting this systematically as this is basically a missing dimension in the universal health coverage definition, which includes the service coverage and financial protection. But to make this happen, you need governance. And we know that without governance, reforms are not going to work. So how are we doing this? Well, again, systematic advocacy events, and I will refer briefly to the action agenda from the UHC movement, which we developed together with a range of stakeholders to have a common basis for a more coherent advocacy to influence the proceedings of the UN high-level meeting this year in September. So next slide, please. So the action agenda includes 8 areas. And I'll let you read them, but one which is really important is action area 6. It's about moving together towards universal health coverage. Next slide, please. And basically, we have 3 key actions, which includes championing participatory, inclusive governance, and coordinating a meaningful whole of society approach for universal health coverage and health security. Second, this involves institutionalizing mechanism for inclusive health governance and adopting policy frameworks that enable and resource social participation. It can't be ad hoc because otherwise it will remain a tokenism. So institutionalization is key. And 3, it's about promoting trust and transparency by strengthening accountability in health governance. So in terms of milestones, we want to see national health policy frameworks which establish inclusive participatory mechanisms for meaningful and truly inclusive engagement of all stakeholders. And then, of course, independent accountability bodies. And secondly, we want also to see adequate resources at the national level allocated to this purpose. Next slide, please. So in terms of progress, well, this is what the UN high-level meeting political declaration says. And there is a real renewed commitment to strengthen health governance. It includes this paragraph 104, which is about promoting participatory, inclusive approaches to health governance, involving all relevant stakeholders, and then in the design, implementation, and review. to systematically inform decisions that affect public health, so that policies, programs, and plans better respond to individual and community health needs, while fostering trust in health systems. So I think the language is quite powerful. Of course, it doesn't go as far as promoting the institutionalization, but we'll see how we can get there. And the paragraph 47 is quite good because it's about the overall political leadership, and in this connection, and how to have policy coherence, to have legal frameworks. There is a reference to the whole of government and whole of society approach and social participation. So these are also good links to have. So in terms of progress, we know that few countries have this formal, effective engagement mechanism. So this is quite good to have that at the high level. We know that only 26 of the 153 countries that we reviewed as part of the UHC 2030 work on the state of UHC commitment have accountability mechanism for UHC. And what we know also is that most of these mechanisms are very often specific to some disease, and this is not surprising. So we need to do a better job, and keep the momentum. So I will then mention a few opportunities in the coming year, in 2024, and I would like first to refer to what's going on right now, UHC Day. UHC Day was yesterday, but we can celebrate the whole week and maybe every day during the year. Next slide, please. Sorry, I've lost my thought of train. So we know that we are off track with UHC, and the fact that half the world population lacks access to health services, and then 2 billion people face financial hardship. You could argue that this is one of the most blatant violation of human rights. I mean, health is a right. So we need to do a better job with advocacy. Since 2016, UHC 2030 has been relatively impactful in terms of creating a movement, rallying a diverse range of partners across health and also beyond to unite behind universal health coverage. But we know that we need more, and obviously at least it's already a good achievement that all the different groups working on specific health issues believe in universal health coverage, which with a primary health care approach provides this integrated approach that is necessary to deliver a good health outcome, because it is focusing on people's needs, and it's empowering people so that they can make their voice heard and also take care of their own health and well-being. But as I said, we need to move and make sure that going on the way to 2030, we have many more people for which universal health coverage is not a dream, but a reality. So this is why this year at the UHC Day celebration, we've decided to target parliaments. I mean, they are the ones who have the power to really make reforms happen. They are the ones who can translate political commitments into action, because they hold the they have the power to legislate, they have the power to adopt budgets, and they have the power to oversee government's action. So we have prepared an advocacy letter. You can download it. I will put the link in the chat box, and please send it to your parliament. I mean, today, tomorrow, the day after tomorrow, early next year, or maybe through IAPO as part of your ongoing calendar of advocacy, you can adapt the letter and send it at the different point in time. I think we need to make sure that we sustain the process, make the voice heard, and parliamentarians need to make sure that they are aware that they have this power and they need to know what they can do. And Justin mentioned in his video message how it is really important that they adopt legislation that prioritize UHC and also prioritize focus on groups who are at risk of being left behind. They need to know that they need to prioritize investment in primary healthcare, and they also need to make sure that this democratic health governance is also becoming a reality. This is for now, and for next year. We have a process where some member states are championing social participation and working towards having a resolution on social participation. So next slide, please. And there will be a first presentation at the executive board of WHO at the end of January, where a resolution will be presented to propose that it's becoming on the agenda of WHO, and where there is a regular reporting process, which would aim at strengthening and institutionalizing and sustaining meaningful social participation. Because if there is not such a process, I mean, it's going to remain really, a book on the shelf. And we actually have the book. We have a WHO handbook on social participation, which was developed through a consultative process, and consists of practical guidance for policymakers on how to engage meaningfully population, communities, civil society, patients for policy and decision making. But we need to do a lot more for this to get traction, and hopefully the resolution will be a first step. I hope that we will be able to work with IAPO in taking this process forward. And before I close, last but not least, I think we need to sustain the process globally as well and bring universal health coverage where it matters, where discussion takes place. And for example, we need to make sure that universal health coverage is being seen as part of the climate change response. This year, the COP28, there was the first ever Health Day, and it rallied more than 100 ministers, and they adopted the Declaration on Climate Change and Health. But we need to make sure that universal health coverage and primary health care, which provides the means to build resilience communities, is being integrated in the climate change response. We need to bring UHC into the AMR, and next year there will be a high-level meeting. And we need to identify those opportunities where we can, create more a stronger movement and unite with other allies. And last but not least, next year at the UN at the UNGA, there will be this summit of the future. This is what will be somehow the beginning of a process paving the way for post-2030 and also some reforms in the UN. And it's important to make sure that health and universal health coverage is being, included as a kind of key lever to make progress towards the SDGs overall. Very often you have UHC champions speaking about this when it's about health, but elsewhere they forget about this. And we could see that at the SDG summit in September. Nobody spoke about health, and it was basically a missed opportunity. Thank you.
Thank you, dear Marjolaine. Wow, I really don't know where to start. I'm overwhelmed with all the information from all the speakers, but it's very hard to be moderator in such a panel, I think, when there are so many important issues raised. And thank you so much for really linking from global to local and how patients can engage, and then bringing back to local, because I think those global venues that you mentioned, those global convenes, COP28 or the high-level meeting, the Summit of the Future, they're all opportunity also for us to showcase the good examples that we just heard from Nicola and Elos. So working at the local level, but also preparing to showcase that actually some of the governments are championing much better than the others, hopefully inspiring other governments or other policymakers to take the same path. So I think the role of patient organizations in successful achievement, even of small steps, can echo and can go far away if we present it in the right place. And we're really grateful for the UHC 2030 making the floor, making the space for the civil society to present at those events and the patient voice to be heard. Thank you so much. But I think the last part of your presentation before talking about the social participation was really about how this year's UHC Day we can make a difference. And the idea with the letter is quite innovative, it's quite touching. If parliamentarians receive number of letters, I don't think that they will really be not thinking about it or not thinking about taking an action. And why, and that it is very relevant speaks also a question from the chat or a comment in the chat that was posted even before you spoke. So I think it's very aligned with the needs of the patient organizations on the ground. And this comes from Non Smith, from Non Helena Smith. Thank you, Non, for sharing this experience where she says that South Africa still doesn't have national health insurance, which is one of the important achievements if we want to have universal health coverage. And she said that only recently they adopted the National Health Insurance Bill, still with a lot of opposition. But it is at least one step further in being signed into a law. So this really takes me to Nicola. If I may ask Nicola, how can we better support patient organizations which are at the earlier stage of their advocacy? And how can they develop sustainable strategy towards UHC in their localities?
Thank you. Gosh, fascinating discussion so far. This topic has been really at the heart of the thinking of the global patient think tank. As members really see it as critical for moving forward. I think supporting patient organisations in understanding the political context of UHC and the politics of policy making in a local context at local level is really important, and somehow unpacking the mystery of UHC, which, as we've heard, is essentially the right to timely, safe, quality-oriented healthcare without undue financial hardship. And I really liked the ideas that were expressed by the last speaker of linking it specifically to AMR, to climate change, etc., because I think this is an important broader context that will provide patient organisations, patient leaders, even more hooks to get their really important policy asks across. I think supporting patient leaders at local level, understanding the real importance of their voice and how best to channel that in a local context, and also helping them to really take stock of their tremendous skills, their superpowers, their networks, to be able to build a strategy. They're coming from an extraordinary position of strength because of their unique lived experience. And although one size doesn't fit all, I think we can learn a great deal from good practice case studies and examples of successful advocacy, but also being honest about when we failed. We've all failed in advocacy efforts and campaigns, and we can learn so much from that as well. And of course, peer support is critical, which is why the work of IAPO, of EPF, of platforms like IAPO, the International Exchange Experience with Patient Organisations, are so important, and the deep links and friendships with sister organisations from the wider civil society movement. So in a nutshell, a lot that can be done to really, I mean, these organizations, these leaders are so important and so powerful, and they just need a little bit of a helping hand, in my view, sometimes.
Yeah, Nicola, thank you so much. And I really think that sometimes it's also helping hand, but also reassurance that they're not alone, because I think all these webinars really show that actually the problems related to universal health coverage might be universal, maybe not equally relevant to every country, but still many countries, if not all, they have some gaps in achieving what we want to achieve. And with this being said, when you said maybe they need a little bit of support, I would really like to call Elos now to also link to another question in the chat that was related to vulnerable patients that universally in many countries, even though we can define vulnerability in different ways, in different contexts, they still always most universally most equally suffer across different contexts. So I would like to ask Elos if you can share, because hepatitis program was also linked to a vulnerable group in your country. What would be your recommendation that you can offer to patient organizations on the ground to engage with the UHC agenda in their countries? Where to start from?
Well, I think what we need is for patients with lived conditions, they need to come together and form either alliance or an association, so that they must be meeting and giving support to each other. The type of sustained association which can be organized can start at the local level. As we are saying, all efforts now are going at the PHC. So at PHC level, we need the structures where patient organizations can mobilize themselves into a group which must act as a voice. Then at the national level as well, we need those type of organizations. We can have disease-specific associations. And out of the disease-specific association, they can mobilize themselves into an alliance, a complete, comprehensive umbrella alliance for patients, so that as they engage with the policymakers in the local governance structures, it should be the patients, not the single disease or the single disease alliance, NCD or rare disease, but it should be the entire whole diseases going in the governance structure as patients. That structure, once it is at the national level and it is at the local level, I'm sure patients would be given now room to participate in the UHC. In IAPO, what we have seen is there are also gaps even at the regional level. At the regional level, it's the single disease alliances that are existing. We don't have an umbrella patient alliance. So as a IAPO, we want to start as a pilot to have an Africa patient alliance. That should be an umbrella patient voice. That once that works, it may go into the other regions, and then it may also filter down at the national level. I'm happy to report that at the national level, we have also national patient alliances in some countries, in the Philippines, in South Africa, in Uganda, we have national patient alliances. So what we need is that type of structure. And then the other issue is in the engagement mechanisms. Patients must be recognized as standalone. We shouldn't be subsumed into the language of communities or the language of CSOs. Patient organizations must be given prominence in their own right. Thank you.
Thank you, Elos. And I really am glad that you're mentioning the National Alliance is also organizing at the regional level, because I think the voice can always be more amplified if National Alliances exchange, and the Africa Patient Alliance being one of the examples starting to work more on regional level sounds like very promising. But also what you mentioned earlier in your response, the links quite well with the institutionalization of the processes in which civil society, but as you rightfully say, the patient voice needs to be present on the same table in a systematic way, and not ad hoc, and not just as a tokenistic approach. So I think this really links well with yet another question that we have in the chat, which first I addressed to Marjolaine, but maybe to the other two speakers later on, and that is how we can participate or involve in any of these programs. And would you maybe care to tell us, I think, Marjolaine, it was really fits well this question with the social participation resolution, and can you tell us a little bit more on how patients can, what we can expect, or how we can help with shaping it or promoting institutionalizing? Thank you.
Yes, thank you. I think it's great that we are already connected, and obviously in UHC 2030 we are keen to work closely with IAPO and your member partners. I think to sustain the process, we should, have like at least once or twice a year an event like we have now, so that we know that we can join hands and make sure that we make progress and develop our plans together. Actually, we were able to make the case to bring the patient's voice at the UN high-level meeting, and Neda had the privilege to speak on the panel on primary healthcare, made a great contribution. Then I think we need to work more closely together in terms of feeding into our respective consultation on relevant issues. And for example, UHC 2030, we don't develop technical papers as such. I mean, we rely on existing expertise from WHO and other organizations. But then what we try to do is translate some of this knowledge and norms into more accessible language that can be used for advocacy purposes. And for example, we are preparing a series of briefs on UHC and pandemic prevention, preparedness and response, on climate change, on AMR, and digital health. So, these are certainly subjects where you may also have, something to say, and we could benefit from your experience and expertise. And and I'll come back to the country level work, but for the World Health Assembly social resolution on social participation, we still need to develop the advocacy plan for next year, between January and May, when the World Health Assembly takes place in Geneva. And as soon as we have it, I'll make sure that I'll share it with the Secretariat of IAPO. And we should definitely identify how we can leverage our respective power, membership, and entry points. And this should definitely include also different patient organizations to bring this to the Ministry of Health and say, hey, you will be in Geneva in May, you will be asked to adopt this resolution. Please, prioritize, focus on this, make sure that you vote for it, and this is important, and why. And so we'll certainly develop a plan that is relatively easy to understand and take forward. We should not have something overly sophisticated that we are not able to implement. So I will come back with some further news. And at the country level, I would like to mention one thing that has been quite impactful. As you well know, very often this fragmentation we see is also driven by the funding architecture, right? And we've seen that the HIV and AIDS advocates have been so successful that you have the global fund with so much funding that it's sometimes also creating issues at the country level. Of course, we know that because of the big challenges in the 90s around HIV/AIDS. I mean, of course, this was necessary, but now maybe it's time also to look at how to better integrate, intervention. But and basically, the Global Fund, Gavi, and others, they all have their funding for civil society. They all have their funding for advocacy, which becomes like a single advocacy issue. And through UHC 2030 and also the SDG 3 Global Action Plan, which brings together the major UN agencies and Global Health Initiative together, we've managed to have a collaborative arrangement, completely informal, where Global Fund, Gavi, GFF have been working together, pooling resources together to support capacity building on health financing for civil society in 20 African countries. And they've joined hands to unite and speak from a single voice. And it seems that, as being united like that, they've been able to get the attention from the ministers of finance, to speak to parliamentarians. And I would be happy to share with you the contacts for members in those 20 countries to engage, because I'm sure maybe in some countries some patient organizations are already involved, but it would be great if many more could be aware of that. And of course, the challenge is always to make sure that whenever we have an initiative like this, it's building on something which exists already, which has traction, rather than trying to unite by creating something new, which somehow adds to the fragmentation and defeats the intended purpose. Thank you.
Yes, thank you, Marjolaine. I think quite important points, and very, very useful for the patient community to understand how these mechanisms are being evolved or developed. And I think it's also very important that we can see the organically grown from the need, from the grassroots rising initiative in those 20 African countries, and leading to a realignment of some of the funds that were done business as usual probably, but then them also understanding from this massive voice that there is a different need and that they need to realign. And I think that's why Elos's mention of the regional alliance also makes good sense, but also global alliances like IAPO can and should play a key role in really negotiating together with the UHC 2030 or other mechanisms of how we can redistribute some of the available resources to have more equitable access, but also financial protection, the two pillars that you and Justin rightfully mentioned in the beginning. Thank you so much. I'm very glad that the webinar is being recorded, because I myself also have to re-listen to some of the ideas that were shared and some of the points, because they're really very relevant and they can be used in different aspects, in different contexts. I thank you so much. Now the same question maybe to Elos, how can we participate or involve in the program? How can patient organizations start to involve?
Well, from the explanation of what Marjorie has said, what we need is to look at the existing structures, existing activities. For example, at the country level, there are the UHC civil society mechanisms, but maybe in those mechanisms, there may be gaps whereby the collective patient voice is not there. So our participation should be by doing an assessment of what's happening in as far as engagement or involvement of the patient voice, collective amplified patient voice in the CSMs. So we need to do an assessment, and I'm happy that Marjorie has said they are ready to work hand in hand and provide information on what's happening. So that should be the starting point. Thank you.
Thank you, Alice. Nicola, last but not least,
Sure.
how can we participate? Yeah,
I think a
go
lot has
ahead.
been said. Just listening carefully to Elos and Marjolaine, I think additional thoughts from my side. We talked about this campaign to send letters to parliamentarians, and I was just thinking how powerful this could be if it could be coordinated somehow by IAPO, for instance, because if patient leaders and patient organizations sent a copy of what they were communicating to IAPO and IAPO brought that together, that would be a really, really important campaign tool at global level, but it could also filter through. That was one consideration. I think in terms of local organizations getting even more engaged, exchanging perspectives with others, I think IAPO, the International Experience Exchange with Patient Organizations, which IAPO is also involved in, provides a very nice environment. And the next meeting in March will focus specifically on universal health coverage. And I think IAPO also, given its involvement and leadership, co-leadership within the Global Patient Think Tank, can also channel all of the information, resources, and anything that their member organizations may find useful. I think that's something that can be done on an ongoing basis. Another thought that I had in terms of the resolution, the upcoming resolution on social participation, I was thinking, wouldn't that be fantastic if that could be co-created with the community? So a resolution is adopted in May at the World Health Assembly, but it's something that's really been genuinely, authentically co-created with the community. It sends such an important signal.
Thank you, Nicola. I keep jotting all of your inputs, and it's quite a lot, I must say. I will try to summarize at the end, but I think your last point on co-creating the resolution, as much as it is possible, and as much as it would be nice. I think one additional thing that we might do, in addition to what Marjolaine mentioned, please everyone go back to your national authorities and try to advocate as much as possible for smooth adoption of this resolution, because we know how the resolutions are being adopted. They have some implications for the governments, and sometimes there is some resistance, especially if it's not quite clear. But if we as patient organizations and advocates advocate at national level to try and explain why this is important to be adopted, maybe we get a more higher numbers in the resolution. But I think additional what we can do, maybe we can try to organize an official side event at the World Health Assembly jointly between the civil society and the WHO. So I think that might be sending a good signal to everyone that actually this is done in collaboration, and that nothing about us should be done without us, which is the motto of IAPO. Once again, I would like to thank you for your inputs. I would like to thank everyone for sending their questions, for presenting themselves in the chat. We had more than 100 active participants in this webinar. We have taken a note of a lot of activities, proposals. IAPO Secretariat is at the back of the webinar. I would like to invite Danny to show on screen, if possible. Hi, Danny. And really, we have been all taking notes of what are the next steps we can all take together, from coordinating efforts that Nicola mentioned, from staying in touch that Marjolaine mentioned, and that we actually proved across the years that we take on and off during our congresses and sessions, or in webinars such as this, or in offline exchanges, that it is quite important that we stay in touch and that our efforts can make more meaning, and many more. But then I think the Secretariat of IAPO with the newly appointed CEO, which is Danny Mochi here in the on the screen, I think we have heard our messages loud and clear of how IAPO should take forward in engagement the patient organizations to be to hear to their thoughts and bringing them to the global agenda, but also vice versa. So Dani, if you would like to say a few words.
Thank you, Neda. So I just wanted to thank everyone for being here. It was one of the most exciting webinars that we had in the past months, and I can see how much we can move forward with the UHC agenda from now on. And I look forward to engaging with Marjolaine, Nicola, Elos, and everyone here that I can see is very interested in this agenda as well. So we can see how to make this resolution. How can we support the resolution, and maybe also come up with some of the make happen some of the suggestions that you raised here today. And I also look forward to working with everyone from now on. Thank you.
Thank you. Thank you, Dani, for accepting this role, which is really huge. And I think we've put ourselves, or we heard a lot that we still need to take on board. There is still a lot to be done, as Justin rightfully said at the beginning. So I also would like to thank Justin, although he's not present here, for his very powerful message at the beginning. Hopefully we can have a chance to also speak live with him soon when we keep in touch, as we said, as we promised. Thank you everyone for your active participation in the chat, for sending the questions. Some of those that we didn't really have time to address, we take offline and we keep in touch. And someone of you asked if it is one way of engaging to stay in these kind of webinars. And I think this is something we will take into consideration to organize maybe regularly some events that can bring us together and discuss what are the small or big or medium-sized actions that we can all take to push the UHC agenda from local to global level and back. Thank you once again, everyone, and happy Universal Health Coverage Day.
Everyone, bye.